We started this journey a few years ago, and we are just now realizing the definition of who we are. The nursing practice model is a clear definition of the promise we make to our patients. Everyone can look at the model and see who we are. This is how we practice, and this is what makes us unique. This is something we should show our patients so that they know who we are. We are really here for them. We are VA nursing.
The nurse is the key component to making that relationship work, making the environment, making the interventions effective. I think the concept of relationship-based care resonated with everybody, resonated with the nursing department. We had a very good vote participation rate for people voting for a model.
It takes a lot of input. You know, one person's idea cannot make up this model. It was all nurses here at the VA who were willing to participate and share their voice.
If I was trying to explain the relationship-based care model to anyone, I would tell them first that it is our promise as a VA nurse to each other, to a veteran, to anyone that we come in contact with, really any of our colleagues, and it explains how they can expect to be treated.
To hold all the other components of the flag. That's very important, because without the values, the core values, the trust, how could you carry the banner without the ball itself? So it's the backbone. It's just exactly the spinal cord for the whole model.
I think that flag is there for the veterans that serve. It makes you proud of something, you're part of something. And that shows that the people that are caring for us veterans are honoring the flag.
When I look at this model, the first thing that my eyes go to as a veteran is the American flag, the respect that they've given our country.
The arrows are following each other. It means they cannot stop. It's just like a fan. You cannot stop. If you stop it, you don't get the air current. It's one cycle. It's going on, and every cycle pushes the other one.
As a nurse practitioner, I practice medicine, but I do so from a nurse's perspective, and I'm proud to be a nurse. And I still rely on all of that entails. I feel like I have a tremendous amount in common with the other nurses that I work with. My practice is different, but they complement. So it's a definition of what is ours that we bring, what is nursing literature, what is nursing research, that we have a body of work that we can call our own, and that is what we bring to the patient. I think sometimes we are not aware of our impact in the environment, and I think the people that inspire me, I'm not sure they're aware of how they do it, but I think when you see someone setting a positive example, it really can have a great domino effect.
When I think of nursing practice, the first thing that does pop into my head is, did you check your patient? You know, what is a nurse's first step? It's always, go see how your patient's doing. It's never, okay, you know, the aide came over and said blood pressure's high. Okay, well, I'm not going to call the doctor and say, hey, set me up with some more metoprolol, the patient's blood pressure's high. I'm going to go and check out the patient, see what's going on.
Whether we're wearing the tag that says RN, we're wearing a uniform that the public or the patient or the family can identify that we're the RN, we're the LPN, we're the health tech, we're the CNA, is vital.
Nursing practice to me means you have a set of standards, and we have an ideal about what we know, what we do, and how we take care of people and each other.
One of the terms that's used is core values, and when I was giving this some thought, I thought a term that worked for me is actually common values. And so that's part of that relationship, is that I'm working with people and there's a shared understanding of the direction we're going and what motivates us.
Anytime you value something, it's worth something, it's important to you. So if you're incorporating that into your practice, then you're going to value your patients, their opinions, and their health care. And then you're going to do all you can to protect them just like you would anything you value, and to make sure that their health is number one.
Value-based care to me means it's the basis by which nurses should perform, how they relate to patients, how they relate to each other, how they relate to other disciplines. To me, it's your ethical code.
The trust, the empowerment, the collaboration, that's what nursing is. It's like the core, the root of everything we do, incorporating all of that, mutual trust, respect. We really can't take care of a patient if they're not able to trust us, and if we're not showing respect, then everything stops there. They're not going to work with you if they can't respect you.
You've got to include the patient. If they have your trust and they trust you and they have your respect, you need to supply that back to them by earning their trust and giving them respect, that they're just not someone laying there to taking care of for 8 hours out of the day. It's someone that you got to get involved with and show them that you care.
Collaboration is a really important component in the relationship-based care model, and it's a really important component in caring for veterans. The work just sort of tends to spread itself out, and I think everybody's pretty good about helping each other, and that's what collaboration in my area looks like.
Collaboration is everything, it's daily. I mean, on a daily basis, it's not just myself, the patient, and the doctor, it's the dietitian, it's the social worker, it's the MSAs.
For nurses to have the empowerment to make decisions and collaborate with the doctors to give them our input and see, if maybe our suggestions would work out. It's very important because we're allowed to get things done faster.
It's very important for nurses to be empowered in their practice. Nurses, to me, are like the artery and veins. They push forward everything. And if it's not the nurses that have the power to push this forward, I don't know who would.
Nurses can work anywhere. This is a good place to be.
Healing environment is the environment when it's conducive to the best outcome of the experience of the veteran.
The relationship-based practice model for nursing defines us now, but we are not done yet. This model looks to the future. Imagine where we will go from here. We have much potential. Together, we can make a difference. Where do you fit in? It's time to define your role in implementing our nursing model. As we move forward in providing excellent care for our veterans, how will you help us move forward?